Tonight, we're joined by Cesar Perez from Bilhartz Insurance Agency, and they're going to talk to us about Medicare changes. And as we're coming to open enrollment period, there's always lots of details that change, the minutia that changes.
So actually, I'll be giving just a brief overview of the Medicare program and, just the basics, because as far as the changes, in terms of getting into plan details, we are not able to do so at this time. It's after the 15th of October. And we're not able when we do these types of presentations, it's like more of 101, like a Medicare 101, as opposed to like getting into specific plan details. But yeah, it is an overview, and it does have the updated numbers, at least for 21, because the 2022 numbers haven't come out yet. But at least you will get all the basics, and hopefully, I'll make this as exciting as I can, because Medicare is really exciting. Nothing better for us to be doing here in an evening than discussing the wonderful world of Medicare and health insurance. I'll do my thing, and if you guys have any questions, if you can either write them down in the chat if you think you're going to forget, and we'll open it up for questions. It is a lot of information, so there might be some questions that pop up, and I want to make sure I address those at the end, or there might be some if Chris wants to interrupt, I can, or interject. If you feel that it might be very pertinent, then I can address it then and there. Sometimes as I am talking and as I am progressing, the answers might come in the next slide. So I might just say, hey, it'll come up on the next few slides. But yeah, my name is Cesar Perez, and yeah, with Bilhartz Insurance Agency. And today what we'll be doing is we're going to be giving you an overview of the Medicare program. We're also going to discuss plan options and discuss enrollment periods. Finally, we'll go ahead and do the question and answer section. And one of the things, as an agent, we are not like affiliated with I don't work for Medicare. I don't work for Social Security. Sometimes people will say like, oh yeah, go get help. These people work for Medicare. Yeah, Medicare really doesn't have like an office. So, if you hear that, it's potentially that's not true. They don't have an office like Social Security does. It's mostly over the phone whenever you're talking just like about Medicare. Me or us as agents, we are licensed by the California Department of Insurance, and our job is to educate Medicare eligible beneficiaries about the Medicare plan options and the basics of the program. We do this for people at no cost. We are compensated by the insurance companies, which have commissions regulated by the Department of Insurance. And so one of the things, when you have somebody in your corner, what I like to say is, there's levels of services out there, but what we pride ourselves in doing is we generally give guidance to our clients, and we help them resolve common issues, because normally if you've ever been on the line with like an insurance company, you can be on the phone there for quite a bit of time, and sometimes you get people from India answering the phone, or you might get somebody who has no idea what they're doing because they just started yesterday. And so some of those questions and issues we're able to resolve, and are able to at least guide you into asking the right questions. Anyway, so that's just our little tidbit there for us. So understanding Medicare. So normally, some of you may or may not be on Medicare. If you're not on Medicare yet, that's fine. You can still listen to the information. You might know somebody who is on Medicare. And so the program is usually for people 65 or older. There are people under the age of 65, for example, those who have been disabled for 2 years. And then there are other individuals that will qualify for Medicare based on having a certain qualifying condition like Lou Gehrig's disease, ALS. What's the name of the other one where your kidneys don't work? end-stage renal disease, that's what it is. And so that would qualify somebody immediately. And also, if they're blind, that would qualify them for Medicare as well, even regardless of their age. And so this is the Medicare card. Back in the day or a few years ago, this card was a little bit different. The Medicare number is what changed. Before, it used to be your Social Security number followed by a letter. And so finally, somebody was smart enough to figure out that that was not such a good idea, right? So now they reissued the cards with random letters and numbers. And so what does this card give you? If you can see, it has Part A and Part B. What in the world does that mean? Well, Part A, normally, you're eligible for Part A when you have worked and you have acquired 40 quarters. If you've contributed to Social Security 40 quarters or more, or credits, they also call them. And if you have not, if you don't have those 40 quarters, then you do pay a monthly amount for Part A. If you do have those 40 quarters, it's at no cost. You're entitled to it. And you can see those amounts there on the right, $471 a month, less than 30 quarters. If you have between 30 and 39, $259 a month. There is a late enrollment penalty if you do not sign up when you are eligible, meaning if you're turning 65, you don't sign up for Part A, you will have a penalty, and that's a 10% penalty per year, and it goes for twice the amount of years that you didn't sign up. So for example, if you went a year without Part A, the penalty will apply for 2 years. And some of the items that are covered under Part A are going to be home health care, hospice care, hospital inpatient stay, mental health inpatient stay, and a skilled nursing facility. Now, under Part A, for example, if you are in the hospital, the first 60 days, so if you're in there hospitalized between 1 or up to 60 days, out of your pocket, you're going to pay $1,484. This is assuming that you only have this red, white, and blue card and nothing else. Because you have, cases where people say, hey, well, I have this, this, that, or the other one, and, that's different if you have a plan. Or if you are on Medi-Cal as well, that will be different. And so some of the other items that are covered, you can see down there, skilled nursing facility, first 20 days are at no cost. After that, it's $185 per day. And then after day 100, so if you're in a skilled nursing facility and you are not getting better, they will kick you out because then at that point, it would be considered long-term care, and Medicare does not cover long-term care. Under the Part B program, you also have a premium on that. That's a standard premium, which is $148.50 a month, and normally that gets taken out of Social Security automatically when you apply. If you are already receiving Social Security, if you are not, then you must obviously send payment, and usually they will charge you quarterly. And there is what we call an IRMA, income-related Medicare adjustment. Under the IRMA, that just means that if you're making more than a certain amount, that 148 is going to be higher. So we have some examples here. If you're an individual and you file taxes, you make more than 88,000. You can see on that second column, you can see it's 207.90 cents per month instead of 148, and then on a joint return is more than 176,000, so on and so forth. The important thing, and the reason we like to mention this and bring this up, is a lot of people, when they're getting ready to go on Medicare, a lot of times they will also retire. They might have like a second home, and they might sell a second home. And normally when you do that, what will happen is that might artificially inflate your income. So if you know somebody who's going through that, if their income gets artificially inflated for that 1 year, they will have a higher Medicare premium. However, there is a form that they can fill out if it's just a one-time thing. That way they won't get stuck paying that, higher amount. And that has saved people a lot of money, because if you don't know, you're just going to pay the higher amount, right? Excuse me. And so that's what the IRMA means. Let's see. And so under Part B, you will also have a late enrollment penalty if you do not enroll when you're first eligible. So again, when you're turning 65, you must enroll in parts A and B. And if you don't, there are exceptions. For example, one of the main exceptions is like if you're working and you have employer coverage through your company. If you have that would waive the penalty. That would actually give you, it's called, if you have creditable coverage, you would not be subject to that penalty. Now, the penalty for Part B is a little bit different than the one for Part A, because the penalty for Part B, it's also 10% per year from the 148, if that's how much you're supposed to pay. However, this penalty is perpetual, meaning if you have that penalty, you're going to pay for it forever. And so under Part B, you have an annual deductible of $203 in the calendar year. Once you satisfy that deductible, you must pay 20% of what's called Medicare approved rates. So normally Medicare will have like a scale, and for every code, it's a diagnostic code. They'll have a certain amount of money that the physician can bill you, and you know, if it's under Part B, you would pay 20% of that amount. It covers lab services, home health services, and other medical Medicare approved services. When we say Medicare approved, like if you're going to a witch doctor, that's not going to be Medicare approved. So you know, that wouldn't be covered. And there are certain doctors that do not accept Medicare as well. And so under that circumstance, it wouldn't be covered. However, most doctors will. Now, there's another section of Medicare. It's called Part D. Now, under Part D, that means drugs or medications. And so Part D is the most utilized benefit out there because, you know, if you're taking medications, you take your medications every month, especially if you're treating a chronic condition. And so obviously, you know, that's something very important. The way Part D works, I'm going to explain the structure of it. Now, I'm going to also mention a few things that pertain specifically when it comes to like HIV medications. As you guys know, those are very expensive medications. And so, for example, the structure of Part D, if you are able to see there up on top, it says annual deductible. So the plans have to the structure of the plans has to at least be this or better than this. Normally, there are certain plans that may or may not have that $445 annual deductible. Some plans don't, especially we call them Medicare Advantage plans. Those usually don't have that. But if you come down where it says initial coverage limit to your left, it says up to $4,130. So the way I explain this is that's the amount the insurance company is going to pay on your behalf in the calendar year for medications that you fill. So I'll give you an example. Let's just say you're taking insulin, and let's say it's something like Lantus, which is about retail, it's right around $500, right? But let's say that you're on a drug plan, on a Part D plan, and that Part D plan, your medication falls in, Lantus usually is around a tier 3. Tier 3 means just the level where it falls. Usually the higher the level, the more the monthly or the more the cost to fill the prescription. So let's just say, for example, that one is $40. And let's say you go to the pharmacy, you fill your prescription, let's say you don't have a deductible. So you fill your prescription, you're going to pay $40. They're going to fill it for you. But the amount that's going to go towards that $41.30 is going to be the full amount, the full cost, the retail cost, which is in our example, $500. So after a few months, what's going to happen to that $4,130? Well, yep, you're going to exhaust it. When you exhaust your $41.30, then you move into what we call the coverage gap. It's also known as the donut hole. And so, you know, being in the hole is not necessarily a good thing. And so in the donut hole, what happens is you go from paying your copayment. So like in our example, if our copayment was $40 during the initial coverage limit, and then if we go into the donut hole, then at that point, the cost would go up to 25% of the retail cost. The drug manufacturer gives you a 70% discount, and then the insurance company pays the remainder. Now, in order for you to come out of the donut hole, the 25% that you pay plus that 70% discount plus the co-payments that you paid during the initial coverage limit have to add up to $6,550. That's why that amount is there. And then once that hits that, then you come out of the donut hole, and now your medication goes back down in price to 5%. Now, if you ask me, I have no idea who the genius that came up with this was, but I gotta say, I mean, yeah, I guess it's keeping me employed, right? So I shouldn't complain. But that's the way Part D works, and that's the structure that every Part D plan or any plan that includes Part D must have at least. Now, under Part D, so again, for items such as like HIV medications, those are very expensive. So you guys, a lot of you guys might be on ADAP. So ADAP is a separate program. However, most of the time when somebody has ADAP, they will get some of their medications through ADAP, and then some of the other medications they can fill through through their plan, because those medications might be like generic medications, and they might fall in a lower tier where they might be very inexpensive. Now, it says here drug formulary and tiered formulary. So every company has a formulary, which is the list of drugs that they will cover, and usually the formularies are going to be tiered. So that just means different levels. Like I said, there's 6 levels. Some of them have 5. And normally, the most expensive one is tier 5. The ones that have a tier 6, those are select care medications for like chronic conditions. So normally those, they're not, contrary to what you would think, because they're on a higher level, they're actually not as expensive as the tier 5. They're actually tiers 1 and 2. It would be the equivalent of like a tier 1 and 2, even though it's a tier 6. So those are some of the terms. The other items under Part D are like quantity limitations, and when certain medications are prescribed, specifically opioids and then pain medications, you may have a prior authorization required and a quantity limitation. And then normally, because of what I just shared with you, the donut hole, you have to, in order for you to get a more expensive medication like a brand name drug, you have to go through step therapy. That just means that if there's a medication that will do the same thing that's cheaper, they have to first prescribe the cheaper one, the doctor, and then they can move on to the brand name medication if that doesn't work. There are also requests for exemptions. That just means that when you request an exemption, let's say a medication that you've been prescribed is not covered under the formulary, well, you can always request an exemption, and the insurance company must approve it within 72 hours or deny it. And usually the process, they might ask you, have you taken or tried this other medication? If you have, they will usually approve it. And if you haven't, they'll let you know, well, first you got to try that one. And then, if that one doesn't work, then we can add it to the formulary as an exception, and we will cover it for you, for, the remainder of the year or however long, the doctor deems it necessary. And under Part D, there's also a late enrollment penalty, and there's also an income-related Medicare adjustment, and the income amounts are the same as for the adjustment under Part B. And you can see on the right-hand side, it says you pay. So normally, if you make under 88,000, if you're single, or if you make under 176 and you're married, there's no additional amount tacked on to your Part D premium. But if you do make more than those additional amounts, if you keep going down, that's how much more you would have to pay for your Part D coverage per month. Awesome. So now, just to get a visual, if you guys see, you have your the Medicare card here in the middle, and then off to your left, you're gonna see it says add one or both so these are your options essentially when you're on Medicare. When you have that red, white, and blue, you have two options. You can go on the left, and if you go to your left, you're keeping your Medicare card as your primary coverage, right? And so that's the card that you're going to show at the doctor's office, and you can purchase what we call a Medicare supplement. And the Medicare supplement will cover, or it's also called a Medigap because it covers the gaps, right? So like remember that $1,400 deductible for Part A, and then you remember that 20% for Part B. Well, if you purchase a Medigap or a Medicare supplement, it will take care of those expenses not covered by that red, white, and blue card, right? And then you should also purchase a Part D plan for drugs when you go this route. And so you would have three cards. You would have your Medicare card, you would have the supplement card to cover what the Medicare card didn't cover, and then you would have your Part D card to cover your prescriptions. And so that's one option. However, most of the time, because you do have to pay for the supplement, and then you do have to pay for the Part D, and then you're already paying a Part B premium, it adds up. So sometimes, people say, well, I mean, is there anything else? Well, there is. However, if you're under this option, you can pretty much go to any doctor as long as they accept that red, white, and blue card. And most doctors do. So when somebody says, normally here in the Valley, we don't have any PPO plans, but when somebody says, oh, I have a PPO, normally they're referring to a Medicare supplement, because when you have a supplement, your Medicare is primary, and you can pretty much go anywhere and you don't need a referral, as long as, again, the doctor accepts that Medicare card. If they are not contracted with Medicare, then you won't, you can't see them, obviously. But again, most doctors will. And the other option is what we call Part C. So when you sign up for a Part C plan, what is essentially happening is you are assigning your Medicare benefits to one of the companies that offers Part C. Now, Part C is the equivalent of Part A, Part B, and Part D together in one. So it includes all of that. And also under Part C, they will also generally include additional services like benefits that might not be eligible if you're just under original Medicare with a supplement. Like, for example, a lot of the plans include dental, vision, so added benefits like the gym membership. I mean, I'm sure if you have friends, you hear it all the time. Oh, I have a gym membership through like Silver Sneakers or something, something like that. A lot of the plans, to entice you to join, they will also give you like over-the-counter allowance, and some of them will give you also routine chiropractor coverage, so you can go get your adjustments. Now, I haven't mentioned too much Medi-Cal, because Medi-Cal is like it's a state program. It's separate than Medicare. However, there are people who qualify for both. And there are certain Medicare Advantage plans that are designed for people that are what we call dual eligible when they qualify for the two plans. And we also call them Medis. And there's also plans that are for people with specific conditions, like, for example, diabetics or people with like heart disease. There are specific plans for those people that might give them, additional items that subgroup of people might need, like maybe like a glucose monitor or, things of that nature. And so when somebody is ready to enroll on any of the plans, obviously, they have to have Parts A, Part B, and they must live in the service area of the plan. So normally for the Part C plans, they are all different. They range, every county has different plans. So like, for example, if you are in Riverside County, it would be different than if you are in LA County or Mendota or whichever county you're at. They're all going to be different. Oops, did I lose you guys?
You're connected, but the
I'm sorry. Yeah, I'm sorry. I don't know what happened. I just lost connection for some reason. Are you guys able to see my screen?
we're able to see you, but
Mhm.
yeah, the screen share went away.
Okay, let me get that. Okay, I think we're good now again. I'm sorry, I don't know what happened there. That's kind of weird. Let's see. So I think it has to do with the connection. And so I was saying, in order for somebody to enroll in a Medicare Advantage plan, they have to be enrolled in Parts A and B. They have to live in the plan service area. And when I say service area, I mean county. Every county has different plans. And so county here in Riverside is going to be different than in LA, and so on and so forth. Now, there are enrollment periods. So for example, when somebody's turning 65 and they're going to be brand new to Medicare, what they're going to have a 7-month enrollment window. So that window is going to be 3 months before they turn 65, the month that they turn 65, and then 3 months after they turn 65. When I say enrollment window, I mean that number one, they're able to enroll in Medicare Parts A and B. Number two, they will be able to enroll in either a supplemental plan or they can enroll in a Medicare Advantage plan. Now, one thing that I will mention, it's either going to be one or the other. Like, for example, when you have a Medicare supplement, normally you want to also sign up for a Part D plan for your drugs. However, if you have a Part C plan, that already includes the Part D. So let's say somebody has a Part C plan, and then for whatever reason they sign up for a Part D plan, that automatically cancels the Part C plan and vice versa. Now, during that enrollment window, that initial enrollment window, that 7-month window, not only can you apply for Medicare's Parts A and B, you can sign up either for a supplement or for a Medicare Advantage plan during that window of time. Now, the next enrollment window is what we call annual election period, which goes from October 15th through December the 7th. And that's the period of time coming up here. And that's why you're probably hearing a lot of stuff either on television, the radio, or even online, and you're getting bombarded with mail, so, good time. You can save that if you're going to light up a Christmas fire. You can, dump it all in there because they will send out a lot of items. And during annual election period, you can switch. Let's say you're on a Medicare Advantage plan, you can switch from one Medicare Advantage to another Medicare Advantage plan. You can also go from Medicare Advantage back to original Medicare by signing up for a Part D plan. And you can also go from a Part D plan to a Part C plan. So let's say you were on a supplement and you say, hey, you know what, I want to try Medicare Advantage. You can jump on a Medicare Advantage plan if that's what you want to do. Next enrollment period is what we call open enrollment. I know it's confusing because normally people call annual enrollment open enrollment, but yeah, open enrollment is actually from January 1st through March the 31st. And what you're able to do there is, let's say you either forgot to change your plan during annual enrollment, or maybe you did change your plan, but now you hate it. You're able to switch either back to your old plan or to a different plan. And so the last enrollment period, or rather, there's different circumstances. It's called a special election period. So normally, like for example, if you recall, I mentioned that when somebody has coverage through their employer, they do not have to sign up for Medicare, right? So if they stop working, then they would have a special enrollment or a special election period, and they can enroll in a plan as well as enroll in Medicare if that is the case. And so again, that's probably the most common example of SEP, when you retire or lose coverage. Some of the other ones are if you move out of the plan service area. So let's say you're in a plan here in Riverside County and then you go to LA, your plan might be over there also, they might have it, but then there might be different options for you. And so that gives you the ability to make a change if you wanted to. And also, if you're receiving like Medi-Cal, normally people that receive Medi-Cal, they have an ongoing SEP, meaning that they can change it if they need it or wanted to every 3 months from one plan to another. And The last SEP that I will mention is those who have like a chronic condition. Like let's say there's a plan that's available for people with diabetes, and it just so happens that you were diagnosed with diabetes, or maybe you already had it and you want to jump on that plan. You can do so once in the calendar year, and at any time pretty much. And so understanding again, Medicare, obviously, you know, when you're thinking about different plans that are out there, you want to take into account different factors. A lot of times it comes down to doctors. You know, some people want to see specific doctors. Some people swear by their specialists, so they want to make sure they keep them. And then other people, you know, they have a budget in mind. We're like, hey, you know what? I can't spend the money on a supplement, so I'm just going to do the Part C route. And normally under Part C, those plans here specifically in Riverside County, they're all HMO plans. So you do have a network, and you do have to go through the contracted doctors in that network. And so, everybody's situation is a little different. And then also certain medications that you take, that also would have a big impact on the plan that you enroll in. And finally, if you're losing coverage or you're retiring, obviously that also is going to have an effect. If you're used to a certain type of coverage and you want to keep it that way, then that's going to also determine what plan you jump on. And that is pretty much, the overview of Medicare. I'll go ahead and I'll check. I'm not sure if we had any questions in the chat. Let's see. I don't see any questions, but if anybody does have questions, I see one coming in. And they're asking, isn't it true that you can't have a supplemental plan if you are on Medicare but under 65? Well, actually, no, that is not true. You can have a supplement if you're under the age of 65. However, the tricky part there is the insurance companies know. So normally for supplemental plans, those are underwritten by life insurance companies, and they can't turn you away. However, if you're new to Medicare and you're just jumping into Medicare for the first time, you have what we call guaranteed issue, which means that they cannot turn you away. And you can jump on a supplement before age 65. However, they know that you're on Medicare because you have a certain condition, right? So what's going to happen is they're going to charge you a way higher amount than somebody who's 65 or 66 or 67. So I'll give you an example. Let's say you are age 60, you're on Medicare, and you look up the prices for a supplement. They're going to be like $400 or $500 a month, whereas somebody just turning 65, that same plan is only going to be $120 a month. So that's a huge difference. So, that's why maybe you've heard, oh, you can't have it. Well, you can't have it. It's just you're going to pay for it because, they know that you have some type of disability or illness. And so they are able to have those higher rates. But the good news is, like, let's say you're 63 or 64, you're close to being 65. Well, guess what? Once you turn 65, you're going to get you're going to get that initial election period, and you're able to jump on a supplement without having to prove insurability, and you're going to get it at the price of everybody else. So, that is at least, there's some light at the end of the tunnel. There's another question asking, is there a PPO plan in the Valley? No, again, like I mentioned, most people call a Medicare supplement a PPO because there's no networks and you can go to any doctor as long as they accept Medicare. But a true PPO, the last one that was here was a couple years ago, and it was through Anthem Blue Cross, and they moved out of the service area. The only plan they have now is their HMO plan. I have another question here. It says, if I am dual eligible, am I obligated to keep Medi-Cal if I don't want it? No, you are never obligated to keep Medi-Cal if you do not want it. However, honestly, if you are dual eligible and you have both, the Medi-Cal is going to work more like your supplemental plan unless you sign up for a Part C plan. So, like, for example, let me see if I can go back here. Let me go back to a different in my slideshow and kind of give you an idea or a visual as to what I'm talking about. So So for example, if you're a Medi, think of it like this. You have your Medicare card here in the middle. Normally, you would have a supplemental card to cover what Medicare doesn't cover. But when you're a Medi, number one, it's illegal for anybody to sell you a Medicare supplement because Medi-Cal is supposed to pay what Medicare does not pay. And so essentially, you know, your Medicare is primary and your Medi-Cal is secondary coverage, if that makes sense. And so you have that option. And then you obviously have the other option that I mentioned where you jump on a Part C plan, and there are Part C plans that are for people that have both Medicare and Medi-Cal. Now, I don't know why you wouldn't want to keep the Medi-Cal. Usually, like I said, they're basically paying for most of your stuff. So if you say, hey, I don't want it, then they're not gonna pay for any of your items, so you might have some out-of-pocket expenses. So I would encourage you to reach out and we can discuss the situation further, and maybe I can at least point you in the right direction. I have another question here. I'm on a Medicare Advantage plan, thinking of switching to a Medigap plan. Well, you can do that. There's one. Like, for example, let's say you're on a Medicare Advantage plan, or let's say you're new to Medicare and you sign up for a Medicare Advantage plan. The first year, you have what we call a trial period, and you can go back to a Medicare supplement during annual election period, which is coming up, without having to prove insurability, because you'll have it's called that trial right for a reason. So you can try it. If you don't like it, you can go back to a supplement without having to prove insurability. Now, let's say that you went on that Advantage plan for 2, 3, 4 years, and you no longer have that trial period. Well, you will, if you want to go to a supplement, you will have to go through underwriting. So they will ask medical questions. Now, if you are healthy, they will approve you. But if you're not too healthy, or if you have any type of condition, they may deny you. Since I am on Medicare, can I get a Medigap Plan F? So Plan F is so for anybody turning 65 before 2020 was able to get Plan F. They can still do so. Anybody turning 65 after 2020 is not able to get Plan F anymore. It's been phased out. It's being phased out, and they're able to jump on Plan G, G as in green. And Plan G is essentially the same. The only difference is the Part B deductible, which is $203. And that's the only thing that is not covered under Plan G that is on F. And I believe there's one other item, and I believe it has to do with blood, pints of blood that you can get. And it says, if I don't take any medications, is it still recommended to have Part D? Well, I mean, eventually you're probably going to end up taking medications at some point. And if that's 10 years down the line, well, that's kind of going to be hard, because if you at that point jump under Part D, then you have that late enrollment penalty. And imagine, like, let's say you have, let's say you've been without Part D for the last 5-10 years, and your penalty is $30 to $50 a month, and that penalty is perpetual. That just means that is going to be tacked onto your monthly premium every month, because you didn't enroll when you were supposed to. If you don't take any medications, I would recommend that you buy the cheapest Part D plan. I believe there was one this year for like $7 a month. So at least have that, so that you don't accrue a penalty. And then, if you really do need it later on, then you can switch it to a better one. I just turned 65, but can you get it if you are already not on Medicare? I'm not sure exactly what you are referring to. It says, but can you get it? Are you talking about Plan F? No, you cannot get Plan F if you just turned 65. Again, that was for people that turned 65 before the year 2020. And again, you're gonna be looking at Plan G. That's gonna be your next best option. To be honest with you, Plan G is a lot better, because there's a couple of reasons why. Number one, the monthly premium on Plan G is going to be about $600 to $800 a year less, and you only have to pay a $203 deductible. So you're actually saving, the difference. And so that's the reason why it's so smart. The other reason it's so smart is because, think about it, you have all these people that are older on Plan F. Well, a lot of them are just going to stick with Plan F, right? So every year as they age, what happens to their utilization? They require more care. And so when more of that pool requires more care, the insurance company has to pay more. Therefore, your rates are going to go up, higher higher faster. Whereas if you're on Plan G, you got new people coming in, which are offsetting those that are already, having claims. And so those new people generally, they're turning 65, they might be healthier, right? And so therefore that's why it's smarter to go on Plan G anyways, right? Even if you were born before, even if you turn 65 before 2020, sometimes I explain that, and it honestly, sometimes it just makes more sense because you're saving so much more on that monthly premium. I have a great plan, Inter Valley Health Plan, an HMO Advantage Plan. They take $148 a month from my Social Security, no problems ever. Some prescription copays, very minor dents in my budget, no copays for major surgeries, total knee replacement, and no fees, including 7 days of assisted living. Yep. So most of the Advantage plans, they're going to be very similar in terms of like copays. The 148, they're going to take that regardless of whether you're on a plan or not. So, if you're on a Medicare Advantage plan, most of those plans have a 0 monthly premium. So you don't pay anything more than those 148 that are already taken out of your Social Security anyways. And so that's why a lot of people like the Part C plans. The only drawback, again, is just, you belong to a network, and, you do have to go to the doctors that are in the network. That's the only disadvantage of a Medicare Advantage plan, if I may say. And so, yeah, that's, I don't see any other questions unless anybody else has anything else. We can wrap it up. we really appreciate this opportunity to educate you guys. We've been doing this now for the past, I think, around 5 years. And normally, we're there in person at the Desert Regional. This year, for obvious reasons, we weren't able to be there, but, I'm glad we have this medium of communication, and really appreciate it, Chris. Say hi to Jeff. I thought it was like, what, did you have surgery or something? I was like, you look so different.
Yeah. It's minus the beard. I'm not beard.
Right.
I'm not beard. Well, thank you, Cesar. We really appreciate your comprehensive explanation of all of these plans. And let's see. I was just looking to see if there were any other questions. I see Frank is also thanking you, so we appreciate your being here. And then for everyone to know, you can do a screenshot of the logo and the email addresses up there and the telephone number, or you can save the text. If you just run over the text and highlight it and then do a copy, you can paste it into your notebook or to an email and send it to yourself. And as long as we don't have any other questions right now, then that's great. Thank you so much.
And actually, we have one more announcement. Yes. And thank you, Cesar. Okay. Yes.
Oh, absolutely.
So before everyone logs off for the night, I just wanted to remind everyone that we are going to be attending the Desert AIDS Walk event on October 30th. And we invite everyone here to just come out and say hi. Pets are welcome, and it's always a fun time. And additionally, we also have a survey we'd like everyone to take a quick look at. It is just a survey to show us, what you think about how these programs are going, how, are we doing a good job? Is there anything else you'd like to see during these programs? And just, ways that we can improve the experience. So I posted the links in the chat, and yeah, just have everybody take a look at those. Thank you.
And I wanted to mention that you do not have to donate to be able to walk with the group at the AIDS Walk. So we really encourage you to come out, and as long as you're comfortable being out, it'll be, you know, socially distanced, so everyone will have masks. It'll be a safe environment, but you'll get to see people. And so that'll be a tremendous thing about this upcoming event, is that it's like going to be one of those first live things out. So we encourage everyone to come along, just to come out and say hi and to walk with us. And I wanted to remind you of our upcoming programs. On November 2nd, we're going to have Wasting in HIV with Mark Vincent. And you may not think that this is happening, but it is still happening, where some people are not able to keep weight on, and they keep losing weight. It's not just a redistribution of fat, but it's actually not being able to maintain any fat. So this November 2nd will be Wasting. And then in December 7th, it's going to be Healthy Sex and STDs. And I think many people are familiar with Phyllis Ritchie. Dr. Ritchie was at DAP for a while, and has also practiced in her own practice here in the Valley. And so she is now going to be talking to us. She is running a STD clinic that's going to be a free walk-in clinic. And she wants everyone to know about these services and how best to protect ourselves. So when you come out to the AIDS Walk and you meet a new buddy, you'll want to find out about healthy sex and STDs. I'm hopeful thinking. So if we don't have any other questions or any other comments from anyone, we'll give you back 10 minutes of your day. And let me see. Oh, I just, isn't this funny? So Jeff Taylor just sent me a message. How's it going? His flights were canceled, unfortunately. And Jeff has a really elderly parents who are in their 90s, and he's been home this week helping take care of them. So Jeff sends his greetings, and he obviously is thinking of you by just sending this message now. So I'll let him know that everyone that showed up tonight is doing fantastic. What a handsome group you all are, and beautiful. So thank you very much, and we'll see you next month.
Thank you, everybody.
Thanks.